Professor Vivi is an associate professor at the Harry Law School, and she holds several other degrees. I will not mention all of them, so then we have more time to hear her, which is the most important thing here.
It's your time.
Thank you. I think that you were introducing Professor Aviv Gaon. I was supposed to be the co-moderator.
Yes,
I still think I am, but it's a little bit difficult doing this from far away, so I might just step in and ask some questions later on. I would like to apologize to all those who are attending for not being there. Unfortunately, I thought of leaving Israel on Sunday and traveling to Sao Paulo. I was looking forward to this meeting for a very long time, but somehow, they say that life happens when you're making plans. So life happened, and on Saturday, that there was a joint attack of Israel and the United States on Iran after the negotiations broke down. But to make a long story short, our airspace has been shut down since. I also would in advance apologize if I will have to leave in the middle, and the same thing goes for our first speaker, Professor Aviv Gaon, who I know personally, and his specialty is in IP and AI and all the things in between, so I'm not going to take too much time. I just want to apologize if we have any sirens in the middle. We'll probably need to stop it and go into to seek some shelter. So hopefully this is not going to happen, and we're going to have a wonderful session, and thank you all. And I would like especially to thank Otmar Kloiber, who was kind enough to fill in for many of my duties in this conference. I would like to thank the Brazilian Medical Association for the great job what they're doing in hosting, and again, without us being there, and of course Michelle Glicken, that this could have not happened if she wouldn't be there. So without further ado, Aviv, who, as I said, has a PhD in IP and has many, many more titles. Let me transfer it over to him, and we can later resume with the questions in the round table.
Right. So thank you so much, Leah, for inviting me, and thank you for this wonderful audience. I hope that even though I'm from Zoom, I'll actually be able to have a very interesting discussion. So I'll just upload my slides. Okay. So just giving you a very brief introduction about what I'm going to talk about, and maybe just to help you with understanding the main theme for this discussion. So Leah and I discussed, and we have a very interesting discussion about what might be interesting for your group. And the three topics that I'm going to talk about is mainly related to law. So the first part of my presentation is mostly about copyright and the element that's related to research and copyright, which is something that I believe will be very interesting for this group. And the second part is about privacy, which is a very important part of any medical research. And I believe that with what is happening now with AI is going to be even more relevant for the other discussion, the other speakers, but also for the future of medical development, and especially in this field. And last, I think if I'll have a time, I'll just want to give you a very, very brief outline about what is happening now with the EU and AI, and thinking about the next, I think the next step in research and data protection, which is again very important part. So the first, the three items is copyright, mainly around ownership, privacy and liability, which is in a way connected. And the last and finally part is going to be regulation. So I'm going to have, I guess I have only 15 minutes, so I'm going to do it very, very quickly, so we'll have time for discussion and maybe a few questions. So the main issue when we think about data and medical research, medical treatments, and everything that is around that is making what is now happening around the world. Data is becoming the most important part. When we talk about any element, any aspect of research, I'm conducting a research with a fellow from Google right now, and I think that what we are all talking about is not AI, it's basically about data. And the reason is data is so important is because if you know how to tag what we call high resolution data, then it makes the results even better and more successful. So when we think about data, we have to understand that it's not only about the data itself, it's also the resolution of the data, the quality of the data, and the problem with high quality data, and this is what I'm trying to at least to explore in my research, is that high quality data is either protected by law, copyright law, which makes even accessible to what we call high quality data something that could be considered very, very expensive. Or on the other hand, it might be protected by privacy, which is again, when we talk about usually about medical area, health area, and health research as a whole, most people talk about privacy elements or privacy aspect, which is why I think that privacy is becoming even more important when we talk about medical research. But it's not only about privacy. There are other elements that could be relevant not only for medical research, but if you think about even if you think about private companies that have medical treatment that they're willing to sell to other companies and everything that around that, so copyright it become even more important than privacy. So two main issues: ownership and privacy. And let's start with privacy. Well, when we talk about privacy, and this is I think one of the elements is, I'm not going to get into the element of consent because I understand that one of the next speakers are going to talk about consent, so I don't want to deal with that. But when we talk about consent from a legal perspective, when we deal with that consent with a legal perspective, what it means that, and again, if you look into GDPR and the EU AI regulation and everything that's around that, consent is considered to be the most important part. And the issue with consent is it's not only that it's even one-time agreement or even one-time acceptance. It's all about the process that if you are consenting to allocate data to someone, and in certain point you're deciding that you don't want to that someone will use your data, that the company will use your data, then you have to relinquish your data, and that's becoming an issue. Because if you think about AI in general, or AI technology, or computer technology, and everything that rely on data, and the fact that someone can, in any point of time, can tell you, well, I don't want you to use my data anymore, and that become a legal problem, that become a legal consideration, that's something that a legal authority has to take care of and has to resolve. So one of the problems that we have with consent is not only the fact that we need to ask for consent for using data, we have to track this data all the time, and we have to make sure that the individual is not withdrawing his consent in the future, because otherwise it could result in other legal concerns and legal liabilities, which could be a problem. So one of the elements, as you said, about consent is what we call the privacy regulation in the EU, and that's something that I think has been researched about and something that people have discussed many times. The other element, which is not very important for what we are talking about today, is contractual elements, which basically, if you are using a data set, if you are using a website, and you want to use this website in order to gather information, you could violate what we call terms of use. And this is something that we also have to take, to consider, because if you're making a research and you want to take crawlers and other bots to absorb data, to collect data, you might violate the terms of use, which could result in liability and even other legal concerns. Finally, the third issue, and this is something that especially important for AI research, is what we call ownership and copyright. I don't know how many of you know the concept of copyright. Most of you probably, understand IP in general. And when you talk about intellectual property, there, in medical research, most of the researchers know much about patents, because patents is one element within the IP scholarship, which is very important if you're developing a treatment or if you're developing a drug. But another element which is quite important these days, because it's actually the element that's responsible for data ownership, is copyright. I won't explain why, but in the last 100 years, the IP scholarship developed that when you want to protect data, what protects data is copyright. And if you want to protect inventions, what protects inventions is what we call patent law. So there is a lot of back and forth about that issue. But the fact is that when we deal with data, and when we deal with even if we deal with medical data, this type of data is protected by what we call copyright. And that's an issue, because copyright has many different in many different jurisdictions. The way that any jurisdiction deals with copyright law is quite different, what makes it very difficult for individuals or even for companies to first of all to understand, and otherwise if you want to develop something, you have to understand that in each country you might have different liability issues and different legal issues related to copyright. So in general terms, when you talk about data, and when we talk about data that is used for medical research, what we have to understand that in many countries we can use this type of data, but we have to make sure that in those countries this data is protected by what we call fair use. Fair use is a legal protection that makes it, in general terms, if you're using the data for research, in many countries you are allowed to do that. But if you use this data for what we call commercial uses, which is quite interesting, because in many cases when you deal with medical treatment, when you deal with drugs, and we deal with other health related issues, it's not always about none or only research. In many cases, when you're developing something, you have also what we call commercial applicabilities, and that might be an issue, because if you're using AI today and you have this type of indifferences, if this type of mixed uses, you might be considered to be liable. And what is quite interesting is that there are many cases in the last two years. So when you think about that, this is something that I guess you haven't been engaged with because it's relatively new. And the last 10 years, most of the the scholarship around and the courts and the cases around AI and copyright issues were related to different topics. It was related to books. Google had some cases and other cases. But what I see today, that the courts are getting into the concept of data and the concept of ownership of data, and then you see, and that this is why you see today many cases that actually deals with those issues. So I believe that what we are going to see within the next year or so, we're starting to see many cases that deals with the concept of using data for other purposes, and health purposes could be one of those purposes as well. So I'm not going to get, you're not lawyers, fortunately for you, so I'm not going to get into those all those cases. I just wanted to highlight that the concept of copyright and data and the use that you are doing with this data is something that many countries are dealing with today, especially the US. The US Supreme Court 2 days ago gave, I think, a decision about the concept of copyright and data. Quite interesting. So it's not something that we're not going to have to deal with. It's something that we're going to deal with it today or in the next few years. There are many cases. I just two examples is the OpenAI case that deals with data that is used to create open ads and journalism and other elements. Everyone probably knows OpenAI and ChatGPT is something that is also being debated today. And the most recent case is this one, the U.S. Supreme Court in a case that was related to an attempt to register copyright a creation of an AI. And this is something that I wanted to highlight today, because, and it also relates to a recent research that I'm working with a dear colleague of mine from Google. So many industries are getting to use ChatGPT and other generative applications for medical reasons. I know that today there are, in Israel, Leah, probably can probably give you some more details about that. But I know that many institutions in Israel, Ichilov is one of the hospitals, leading hospitals in Israel. The other hospitals in Israel are also, using and try to develop their own, algorithm, their own app for medical reasons, for treatments. May, in general terms, use the data, your data, the data that is of their patients, to create a system that will advise doctors and physicians when they're treating patients, which is something that we see more and more around the world. And the concept of that is it's not simple, but it's quite easy. You get the data, you use the data, you get a consent from the patients, and then you can develop this algorithm, and you can use this algorithm in the hospital or in any other resource. So, but the question here, and this is something that is also related not only to privacy concerns, but also to ownership and copyright concerns, whether we can use this data, whether you can use the product, and we can license this product, maybe we can license this app that we are developing and sell it to other organizations abroad. This is something that many hospitals and other organizations are considering right now, and that's an issue. Because if you're looking into, what the recent judgment from the U.S. Supreme Court, the U.S. Supreme Court stated quite, quite simplicity and straightforward that if the AI is creating something, this something cannot be registered, cannot be licensed, it cannot be copyrighted. Because if you have someone that provided questions, asked the question, provided data, and this is considered to be a human invention. But if it's all created by an AI, automatically, the Supreme Court, U.S. Supreme Court stated that it could not be copyrighted. It could not be, in that case, I believe it could not be licensed. So that's something that when you think about the future and the future developments, this is something that I think that we should consider. There are other cases. I'm not going to deal with that. There are other cases that deals with the concept of copyright. But very, very quickly, I just want to highlight two more points, and then I'll open that for discussion. One point that is very, I think, important to understand, that in many cases, people all say we should be very, very strict about privacy. Privacy is very important. You have to understand that you have to do whatever you need to do in order to keep our data safe. I don't say that privacy is not important, but I say that what happened in the last I think 4 or 5 years, that we made privacy as something that is much bigger than everything else. And my argument is, this is why I'm trying to push that forward in many cases, many conferences, that we have to distinguish between the different uses of the data. So in my opinion, when you use this data for certain services, and health services is one of those things, in my opinion, privacy should not get the full coverage, the full protection. We have to understand that if we want to allow other system and other development, we have to allow this access to data, because as I said at the beginning of my presentation, without high quality data, we can't develop anything. So in order for us to be able to develop something, we have to make sure that privacy is not everything, and we have to try to use regulation and other legal mechanism in order for us to allow access to certain uses. And in my opinion, whatever we consider to medical uses for the benefit of humankind is one of those reasons. And I think that when you look into the GDPR and when you look into what is happening now with the EU, you don't see that. And that's something that we should take into consideration. Fortunately, when you see that the current regulation with the AI EU, the recent AI regulation in the EU, they actually think about that and address that in many cases. So that was one of the points. I'm just skimming up because I think that I'm running out of time, and I want to get into very briefly. You probably know this. The AI EU Act is something that is getting off trail. I recently published a book about EU and the digital reform that the EU is doing. Just to give you very, very shortly, I don't believe that what the EU is doing right now is good. I think it's very bad. Not only for health, the health environment, but also for the business environment. I think that's we should limit regulation. I think that what is happening now, that the regulation is getting everywhere and everything. And if everything is regulated, it's mainly meaning that you don't have access to certain goods, you don't have access to certain developments. So if you look into the AI EU Act, the AI EU Act getting everything that's related to health. So everything that's related to health is under this strict regulation. And if you want to use and to develop health techniques or even health technologies or anything that's related to that in the EU, you are requiring to abide to this regulation. And this regulation means that this is just a list, just providing you a list of what you should do if you want to develop a regulation, if you want to develop the AI technology that is dealing with health services in the EU. That's what you need to do. So it's much bigger, it's much wider than what we consider to be the privacy regulation, and this is why this is something that is getting into effect within the next part of this regulation already in effect, but other parts are going to be in effect within the next few months or so. So if I'm in this field everywhere in the world, and I want to use data, when I want to use get access to the EU sector, I have to consider those elements, and I have to develop what I call an ethics scheme in order to be able to address those concerns. Otherwise, it's not only about getting a fine. It could be something even worse than that. So the second point that I want to highlight here in this presentation, that it's really important for you, if you're working in a certain organization, to take certain precautions and to understand what is required from you in the AI EU Act, and to understand that the AI EU Act is not only related to the EU, it's basically a global act, because according to this act, every data that is result from an EU citizen, which you think about that, many of the people that are, I guess, sitting in that room in Sao Paulo are also EU citizens. So every data that is related to EU citizen has to go through this regulation. So and finally, I had to end with this with this slide, because I really believe in that. I believe that we have to do whatever we need to do in order that data would be free. I think that it's very important for us as researchers, as scholars, as people that are trying to to develop products that eventually will benefit humankind. We have to be able to have access to high quality data. I don't care if it's for commercial uses or it's for private uses. I believe that even if you use this data to create something, a product, that you want to make a living from this product, and you want to make an invention that will be even commercialized, I think that it's quite acceptable. And if we want to move forward to the next phase, we have to gain access to high quality data. And in certain areas like health and other areas, that means that we have to be less strict about privacy concerns that we are today. Otherwise, we will see what is happening in the EU all around the world. EU has difficult issues with innovation. They have difficult issues with developing certain technologies in that area. And if we don't want to end it that way, we have to think about what we can do for allowing access to data. So that's it. I'm trying to. I hope it's fine, 15 minutes. But I'm more than happy to open that for discussion. I know that you are not lawyers here, so I try to make make it as accessible as possible. But I'm more than happy to answer and to engage with any question that you might have.
Thank you. Thank you. So thank you, Aviv. It was a very interesting presentation, and I'm sure everybody got a lot of information out of it. But I actually have two questions. Eduardo, I think it's okay if I just ask you two questions before we continue. Would that be okay?
Of course.
Okay, so basically you are advocating for less regulation, and you are advocating, I would say, less regulations in general, and to have as much free data as possible, which means less privacy, I would say, restrictions in order to support privacy. And my question is, how would you then deal with a couple of things? How do you deal with data that is misused or is used in the wrong situation? And especially when we are talking about medical data, we can think that if this data would be accessible to employers or to insurance companies, I mean, there's a lot of things that you can do with this data, which is not only research and is not only done in order to get, to benefit mankind. They can also be using it for a different aspect. That is my first question. My second question, it's not so much about the data, but it also is, I mean, I don't know how much truth it is, but what they're saying is that the U.S. has now a very serious problem with Anthropic, because I'm sure everybody came out and said that Anthropic was one of those who helped design, let's say, the attack on Iran, and when they wanted to put on some regulations, for instance, that it has to be a human, it can't be only decided by AI, but there has to be a human in the loop. They didn't like, President Trump did not like these restrictions. So don't you see, I mean, is there not a flip side? Is there not also a dark side to what you're saying? And if yes, how would you want to balance it versus the important need to encourage research and to encourage people using and accessing data?
So thank you, Leah. That's two wonderful questions that basically raise the entire discussion to a different level. And I will tell you that when we think about regulation, I am not anti-regulation. I think that when law is regulation. Everything that is legal is basically, the legal mechanism is to regulate other other aspects. You also have to balance. This is when we think about law is balancing rights. So I'm not opposing regulation, but I'm opposing different types of certain types of regulation. So what I'm saying is that obviously there are concerns, and I totally agree with you. There is big issues with using certain data for other purposes. The problem is that we are facing that what is happening today with the AI means that it's not like in 10, 20 years ago, you could have said, you have to anonymize your data. You're not allowed to use, certain data. Use the data, make sure that you erase the male-female aspect, and that's fine. But today I'm using AI systems that using very, very limited type of data, what's considered to be anonymized data, and the AI can get into information that is considered to be super private. So the problem is not the system and the mechanism. The problem is the balance, and you don't want to to say to take the baby with what we used to say in that regard. So there are what you can do is develop certain agencies that they will be responsible to track this information and to make sure that if someone is using this data in a misused way, he will get punished. He will get fines. He will get. But if you take this regulation to a different level, saying that you are not allowed to do anything, just to give you the example with the consent, the fact that you require someone to give consent to data, that's fine. I don't have any issue with that. I used to have. Two days ago, I visited a clinic, and the physician asked me if he can use the results in his study, and I said obviously I'm not opposing to that, and I appreciate the fact that someone asked me if he or she can use this data. But, and that's the problem, if you are taking that to a next level, saying that in any certain point, I can actually retract my consent after someone already used this data and developed something in the reason. And I can say, I changed my mind. I want to take this data back. I want you to pay me for using my data. That's, I think, where the line should be held. And again, what you just said about Anthropic, and we're getting into a huge discussion about what is happening now with the U.S. and the EU. The U.S. is completely flipped sides. And what is happening with the Trump administration is something that I oppose. I don't think that you don't need any regulation, because what is happening now in the US is saying no regulation at all. That's something that is worse, even worse than having some, a high regulation and saying you don't need a regulation, because I totally agree with you that There are problems, and we have to face those problems. But what I'm saying that this is my responsibility. This is our responsibility as lawyers. We have to find the right balance. And right now, the EU is not the right balance, and what has happened with the Trump administration is not the right balance. And we have to find the middle ground that allows you develop what we need for society on the other one, and on the other hand, not result in serious risks and dangers.
Thank you.
Thank you, Professor Aviv. Thank you, Professor Leah. Thank you for your words. Nós vamos agora.
We will now invite the next speakers. I don't know if our online guests will stay online, but if you have further questions, you can always ask later. So our next guest is Professor Miguel. So Professor Tatiana, I'm sorry. Professor Tatiana is a medical geneticist with a master's and doctorate in science and an MBA in big data and analytics. Please, you have the stage. First of all, it's a great pleasure to be here. I will present in Portuguese. I can see that you all can hear the interpreting. It's a great pleasure to be here and be part of this event. And I am here to talk a little bit about what we have of experience inside the biobank, and a biobank in Brazil, and Einstein's biobank. And I will begin with the sentence saying that the issue is not a lack of consent, because no one's going to consent to be sent to a concentration camp or not receiving a medication if it's available. The issue is that today, and we know this, people are willing to share their personal data. We know this because we have a lot of social media where people do that, and people accept the consent terms. But we still have some people that, even within the legislation, and I agree with our colleague Aviv, that the human capability within what's possible is incredible. And they will look for, even within the legislation, what is right. The use of this data and the biological information that it's not necessarily acceptable in any way, shape, or form. And we need to talk about, we don't even need to talk about it because it would not be acceptable. So when we think about the consent and the future use and broad use within biobanks and data banks. So what's the issue that we face today within our biobank? I'm going to give you some examples. I kind of have brush strokes of some issues. One of the consent issues is that we need to include in the consent everything that will be done with the sample. But the biobank is the only possible way that I have in Brazil to use samples for things that I haven't thought of yet. And this is extremely necessary to science, because I will not necessarily be able to ask consent to everyone every time. And then within this 4-page long consent form, so that we are able to do everything and include everything in the consent form, we need a person that will explain all of this. And I don't know if you stop to consider the bias that this could generate, because it's the trust bias, where the person that is receiving the information would not necessarily understand what is being said. But she trusts me, and this person trusts me and trusts my institution. But when you read a paper in that dry way of a paper, might offer more information than the human interaction that is compulsory and necessary. And of course, I need to make a side note that biobank, the human interaction, eh, it destroys completely scalability. We need to have all these people offering the consent consultation. And what I try to bring is, what if we looked at from the other point of view? So the entry, people need to consent, and they need to follow such and such rules. But let's look from the other side and think that nowadays care and research is a continuous paradox. It's very difficult to say this is the line of research, this is the line of a care. 10 people, if you ask, is care or research? So if I use information from my doctor's office of 500 people that I serviced, and it's research. I use the information that I gathered, but it's care, and this is a continuum. It's impossible to separate the guardianship of health. I'm going to help 1,000 people, 1,000,000 people. It's a question of scale. And the other point is the health benefit. So the health benefit, and then this research is for the benefit of health. Whose health? Who's the aim of this research? So everyone in this room can agree that you have a birth in the hospital is good and it saves lives. But does anyone here in the populations in the world where the relationship is defined by who cuts the cord? Does anyone belong to this population? Not really, but look, how nice. I don't want a mother or child to die, so I sent them to the hospital. But that might mean that that person is not connected to, so they're originating society. So this kind of drastic difference and benefit is very careful. And we have to consider the benefit for all. And remember, what I said, we never begin to something atrocious. So looking at paragraph 12 of the declaration, where we have purpose, governance, risks, data handling, and every time when we create a shape of how things are going to happen, we have situations that will go against this. So I have an intent to my survey, from my research. I have a huge biobank with 500,000 people. I don't need to say which biobank is this, where people ask access to it. And I can ask access to do this type of research. I want to evaluate the risk of a disease that is a common disease such as diabetes using genomic data and income data. Why do I want income data? Because it's a very good proxy of where the person lives. It's very good. So I asked this information, and the biobank offered me this information. I asked it, I want to do a research regarding genetics, income, and population health. And then I asked this question.
Published it. So so the magazine didn't have issues, because it's not a question that we should ask, and we are not looking at this use. So when he mentions the use of it, that's what we need to bring into this declaration, the follow-up of it, and what will happen in case the use can be taken to discrimination, because in the article states that there is a correlation, and then they justify with genetics and intelligence. Okay. And the other thing here that we face is what we should do with those specimens. Many people say that if it's anonymized, okay, then it's fine to do it. And then I do the complete genomic, but I can't go through reasonable paths. It's just a fingerprint. All those things are identifiable, and then those specimens resume to perennial and identifiable data. So when we have those biobank and database that were like very strict and data related to the specimens, then they go back to be continuous again. So metaboloma and all the things, and another OMA that I can make up here, we will have that, and we have to be prepared for those technologies, and everything identifies the subject. And then for this trait of population, I don't want that. And sometimes we talk to the agents of the government, and then we are not sure if they should have access to the genomic data of the population. We are speaking of this continuous care, and then we have a unique health system, but we don't know what will be done without the intentions when people have data in their hands. So what are the intentions? And then within this continuous care, today the biobank as if it were a broker. The volunteer gets into the process talking about what biobank is. They understand what biobank is. I'm speaking as a manager here because the understanding is hard. If I sit down with you here and speak of my genomic research, I'm sure that many of you will not understand what this is. So we have this environment, and then we have the interface with researches that are totally new and challenging, and then we need to give outcomes back to this person. For example, I'm the manager of the biobank. A research used the genomic data of biobank and it brought outcomes, actually brought risks back to this breast cancer. And then what is the accountability that biobank must have, which is not an environment that all those things should go through, because I don't have oncologists and other specialties in my biobank. And then they don't give back those outcomes to people because they are not only related to the subject but to the family. So we are actually going beyond what we should. Remember the case that we had about a thief that were mistaken, was arrested. So, but then, okay, let's stop everything. Let's just stop the research. No, it's not like this. The people don't understand. Actually, people don't understand the sharing, the importance of sharing of it, and many times we see in a different way within legislations, and we needed to look at it and understand all the risks and act as soon as we can when we see something. So here this social media paradox. Everybody says that social media is the worst thing that we've had in the mankind. It destroys families and all the movement among all the teenagers. So what happened here? So the use of data that were open or they were not regulated, and teenagers suffered because they didn't understand how to use it. Their consent was not valid, and even social medias brought solutions to protect those groups. So today we have Instagram for teenager, we have YouTube. The YouTube already detects images that can bring some problems, so they have mechanisms to detect fast. Okay, and then we can spend the whole afternoon discussing if it's right or not, but we have to see when it's possible to detect something that is not going right. So if we are able to be agile here, I'm in favor of this consent form to apply it, but we'll never be able to foresee everything, all the risks, and we'll never be able to cover all the uses of it. So if we prepare something for the future to be agile and change the destiny, to change the direction, that's what I think that is missing, especially when we talk about it. We unfold that like the populational health, but we don't unfold the mechanisms of it. Because if we did have them, maybe things wouldn't happen like this. So people are not leaving their data because they don't understand what it is, because they think that something good will happen to them and to others, and that's what we have to ensure. I don't know if I was able to give the message. Okay, so sit down, please. Now, Professor Miguel Jorge, our third speaker. His biography is very long. I could spend the whole afternoon speaking of it, but he was the president of ABP and the WMA. So please come here.
Good afternoon. After this excellent presentation by Tatiana, I will try to make some contributions here. I want to thank Dr. Serrano for inviting me to participate in this meeting on behalf of the World Medical Association work group, which is revising the declaration of Taipei. I think the work of this work group is challenging because the last time the declaration was revised was 10 years ago. And many different things happened since then. And I think nowadays, health database and biobanks are quite different things. Because as Tatiana was pointing out, health database today includes a huge amount of health data that people are changing in the internet, in the social media, and that can be objective of research. I have a previous experience in participating of the World Medical Association work group, which revised not the current, but the previous version of the Declaration of Helsinki. And I was also a chair for 6 years of the Research Ethics Committee of my university, which is one of the top 3 in Brazil. Now is chaired by Roseli, who talked this morning. The theme that was assigned to me was transparency with participants, uses, results, and incidental findings. In the preparation of this presentation, I have done a comprehensive literature search, and I didn't find a considerable number of papers related to transparency with participants, uses and results. Nevertheless, there are a significant number of papers dealing with searching for and communicating or not to participants incidental findings encountered in an investigation, but not particularly related to health databases or biobanks. Even not using artificial intelligence to prepare this presentation, I asked Gemini, Google's artificial intelligence, which are key reasons for transparency with research participants, not just or particularly in health databases and biobanks. Gemini listed 6 key reasons: building trust and confidence, ethical obligation and informed consent, sharing results, encourage future participation, data use awareness, and improving research quality. Nowadays, it's possible to find in the web health-related data of individual persons collected from the use of different personal gadgets, including mobile phones. The collection of this data from a large amount of people can be focus of research, even considering that they were not posted by individual persons for that purpose. So, big data represents a major challenge to research ethics if it really involves an astonishing number of individuals that cannot be reached to give an informed consent, jeopardizing transparency with involuntary participants and possible research ethics. In an online search of ethical implications of health-related big data present in documents regulating investigations, Ferret and others found privacy, informed consent, data transparency, and data security the main themes of concern. They listed 3 considerations to be taken when doing such investigations. If individuals are informed about the use of their data, possible breaches in data privacy and confidentiality, and the use of those data to discriminate applicants to health insurance services or jobs based on health risk indicators. The Declaration of Helsinki, in its item 26, states that, quote, all medical research subjects should be given the option of being informed about the general outcome and results of the study. End of quote. Further, item 36 indicates that, quote, researchers have a duty to make publicly available the results of their research on human participants and are accountable for the timeliness, completeness, and accuracy of their reports, end quote. Curran and others consider consent forms an ideal place to indicate that results of research will be provided to participants. Nevertheless, examining 121 institutional consent documents in Canada, nearly half of them didn't have any wording in that sense. Lázaro Muñoz and others, dealing with psychiatric genetic research, found that 24% of investigators return results to individual participants, and 54% of them plan to return. Just 14 of them agree they know adequate guidelines for returning results, and around 60% of them consider they have poor knowledge on how to manage the process of returning results. McDuffie and others covering open science initiatives to democratize access to research products recognize that these initiatives have not yet addressed an obligation to ensure that research results will be provided to research participants. According to Wolf, the return of research results and incidental findings to participants is a key frontier in research ethics and practice, and she recognized that there is a growing consensus on investigators offering to participants at least individual findings of high clinical importance and actionability. Sandby and others conducted a cross-sectional online survey with different stakeholders about receiving genomic findings, and almost all wanted both pertinent and incidental findings be made available for research participants. Thorogood and others outline three procedural steps for the feedback of individual research data to participants. First, assessing the health relevance of a finding, re-identifying the affected participant, and three, communicating the finding. Re-identification requires to break the codes which protect participants' identities. This process needs to be done by a trusted and independent person who control the access to a database containing the link between research data and personal identifying data. The same rule applies to the process of anonymization. Nobody from the research team is responsible to anonymize the data. There is a third party not related to that team to anonymize data. On regards of incidental findings, which appears in the Declaration of Taipei, Wolf has offered a definition for it in 2008 with a small addition in 2013. And the definition is, quote, a finding concerning an individual research participant that has potential health or reproductive importance, and she added years later, or personal utility, and is discovered in the course of research, but is beyond the aims of the study, end quote. Rapid technological advances, the evolution of research capabilities, large volumes of data, and the push for innovation contribute to increasing the probability of incidental findings in research involving humans. Mark Rothenstein include the right to be offered information about important incidental findings in his 2025 Bill of Rights for Clinical Research Participants. Middleton and others conducted a cross-sectional web-based survey to investigate attitudes of nearly 7,000 individuals from 75 different countries towards returning incidental findings from genome research to participants. The vast majority of all stakeholders, mostly about 20%, thought that both pertinent and incidental findings from genomic studies should be made available to research participants if they wanted them. So when we do a kind of informed consent, one item that needs to be included in this kind of research is that if the patient or a relative of the patient assigned by him wanted to receive this kind of information. And in this survey, Middleton and others didn't find any difference among different stakeholders and even from different countries. In the current version of the Declaration of Taipei, Item 12 of Ethical Principles specify in point 4 the procedures for return of results, including incidental findings. Point 8 of those ethical principles is, in my opinion, questionable, as it states, quote, that in the case the data and material are made non-identifiable, the individual may not be able to know what is done with their data material and that they will not have the option of withdrawing their consent, end quote. I believe it's well established that research participants can withdraw from any research whenever they wish and without any penalty, even as a patient from a service where that research is being conducted. Besides that, the process of anonymization needs to be done involving someone who is not involved with the research and then can be asked to re-identify the data. The way which health databases and biobanks are created needs to be improved to meet with ethical requirements aiming to protect participants' rights. Some other suggestions for a new version of the Declaration of Taipei would involve to include, in the end of item 20.2 of governance, that, quote, any relevant information on health database and biobanks must be made available to the research participants and the public. Currently, we see there just the public, not the research participants. I also suggest to include in governance, in the end of point 7 of item 21, as well as, quote, as well as for sharing with the research participants or relative, if deceased, even if the participant is deceased, the pertinent and incidental findings of the research. I hope the process of revising the Declaration of Taipei, involving so many people around the world, would end with a better version on regards of respecting and protecting health databases and biobank individuals involved in research projects. Thank you.
Por favor, professor, senta na mesa.
Please take your seat, and we open the floor for questions. If anyone wishes to ask a question, our speakers are here. I have a question for Professor Tatiana. You mentioned, doctor, that you lead the Einstein's Biobank. I would like to know from you, what is the greatest difficulty you have regarding the relationship with health professionals, especially doctors? You're putting me in a difficult situation. We realize that especially the including of the consent form in the care routine is an issue. Not only because of time constraints, people don't have the time to give this consent form, but also because of something that I mentioned, the bias of treatment. How can you treat someone and you say, oh, you can be part of the biobank, the research, but you don't need to, if it's okay. You have two issues there, and I'm not even removing the time constraints, but how can I truly separate in the patient's mind that they cannot be part of something that their carer is offering? So you have this issue, and at the same time, because we cannot include the consent form within the routine with all these cares, we miss a lot of opportunities to improve science because the volume of entrance is very small still. So we have examples, for example, Vanderbilt Biobank. They created a consent form right at start. You go in and you sign the consent form. It's part of the document. I signed the document that I'm going to be admitted to the hospital. There's a term. And then everything is directed to research. So if we had the opportunity of being able to add the consent form in situations that are not so completely related to the assistance to the biobank, I think we will have a lot of gain. Very good, thank you. Professor, from when you were the president of WMA to today, what is significantly different in the Helsinki Declaration and Taipei Declaration when we talk about the modernization and the AI arrival? What is the main things that you can mention?
Of the WMA exactly in the first year of the pandemics. So I think after that many things has changed, but not far away from that time I was not participating anymore of the WMA activities. So I can tell you, you know, from the inside of the WMA what was changed in the terms of discussions. Maybe Serrano, who is the current representative from Brazil in the Council of the World Medical Association, can answer better your question.
Thank you. Alguma pergunta?
Any questions? Please, a microphone. I'd like to give a message. Professor Leah is still here if you want to ask any questions to her. And maybe she can help with an answer.
From the Brazilian Academy of Neurology. Congratulations for the great session. So let's think about a hypothetical situation. We know that AI depends on data, and we know that AI can be used to improve health. Both patients, researchers, and physicians, all of them want to improve people's health. Let's say a situation that we know that data can be used in the wrong way to do unethical things, but we also know that what drives science and what drives improvement is exactly disruption and the possibility really to, discover new things. And so let's say we have a database, a retrospective database, and the legislation requires that every time an investigator wants to answer a research question with the data, all the patients who were admitted had to consent. And then some patients, let's say they have a very high income and they understand the importance of that work and they want their data to benefit as many people as possible. So those people, they provide the consent again and again and again. And some other people, due to social issues or illiteracy, they're not able to do that. And the AI model is going to be created based on data of those people who consented. And how is it ethical to consider that we're going to build models to specific groups of people because you already introduce bias when you have to consent all the time?
Please.
Eu vou responder em português.
I'm going to answer in Portuguese. The entry bias already exists in the biobank. It's not even a hypothesis. When you open the door and ask two people enter the door, you can generate a bias. The bias of disease. People have more disease when they come by themselves, and access. Because at least I needed to get into public transport and get there, or you want to be able to read and so on. So there are some initiatives that say, so we need to do this epidemiologically. So we go to the person, do a epidemiological census, you go all the way there and ask them if they want to be part of it or not. It's a type of a solution. But this entry bias, independently if I have to consent once or 5 times, it will always exist from one side or the other. You can go to the other end where the person that has less access doesn't understand. I hate this analogy. And then they go in and the person that has more education, more access says, I'm not going to because I don't want to share. So to minimize this type of bias, it's not only related to access to the database. That's why Aviv mentioned very well the data, the fact that the data exists, and we are able to get there. But the model could generate a bias because of the simple existence of the bias data. So independently of the survey, the research that you're doing, like there was a model that identified criminal based on the skin color. Nobody said that it was supposed to do that. But most of the people that committed the crime had a little bit of a skin color. So the system decided to use this variable. And who was controlling that? Another model that was incredible that said that the girls were calmer than boys. And they made all the MRI for girls in the morning and boys in the afternoon. And why do the girls do the MRI in the morning? Because girls are more developed neurologically. Come on, gender doesn't define that. It doesn't make sense. It's the age. The 2-year-old is less developed than a 10-year-old, not the boy and a girl. So you created a line that girls can only go one way and boys only the other way. So there's another barrier in these models, which is a discriminating tests. This needs to happen. It's part of one of those barriers that we need to create in the post-execution. And these barriers will tell us look, it seems that this data is related to this variable, even if this variable is not there. So some models can identify the skin color through the X-ray. How? I don't know, but they are able to. So these barriers imposed that we need to include and be able to deal as much as possible with these biases because they exist and they're not going to go away. Go on, you can ask. Following the same line, Tatiana, because my question is to provoke. How far adding the needs of consent, the multiple needs of consent, are more important than certifying that the data is used within a construct that generates benefits? And who decides that? The other question is, what's the level of involvement of the patient, of society, to decide these policies of data usage? Because I had a number of patients that said, doctor, if I'm offering this data to research, I want to benefit as much as possible. I don't want to be coming here every single time if you have a same subject survey, a research. Why do I need the consent repeatedly? And what is the effort involved to understand the patient's opinion regarding this? Of course, privacy is important, but do they understand the scope of the survey and the decision that they can make upon defining these processes? I think Dr. Serrano was going to speak. Can I make a comment? As far as I know, I don't know if it's changed since I left the ethics committee. CONEP does not allow the broad consent. Consent has to be related to the research. When we talk about big data and biobank and database and health database, it's very difficult. The process is completely different. So there should be a change in this policy that says, as you mentioned, that sometimes the patients themselves are completely agreed with what they're the sample or material that they're supplying to be used. But we need to define what's the limit of when the broad consent cannot be used. If there's any chance that will represent the risk to the participant, the consent cannot be used. Then really you need to call each person. But there are a number of situations that this broad consent should be used, and this will help a lot with the advance of science.
But you can answer in Portuguese if you wish. Looking at the declaration type A, regarding the topic biobanks, what do you suggest that we should change or not change? Do you find a special point, on your opinion, that we should be reviewed?
I don't know exactly if it's specific points, because the declaration mentions common sense and that my biobank already is compliant with. But maybe a point that should be discussed in other moments is the need to have someone explaining this consent. This is not general research, but something that technology can't handle. So if I want to listen to Spotify, I have to supply my data, and that's the only way for me to use the tool. There's no more coercion than what happens in Spotify. So if we could include some points where there might be a way that I can be broader and clearer. For example, the UK Biobank consent form is 1 page. Yes, I want to be part of research, and I offer my samples. It's 1 page that the person says, yes, I want to be part, even if there's a publication that says that there's a genetic relationship. So that's a little bit what I feel that it's missing. That we could have a portrait of what's our ethics, be it CONEP or SEP, and that it be portrayed there. But creating difficulty of access in many situations. Okay, we have biobanks that will have funding to put a lot of people, and then biobanks that have no funding, and people cannot participate in the research because of access. So we need to try to consider a way that the entry is more general, and this is what I feel with the declaration, that the entry is regulated. I need to consent to everything, but then my consent doesn't need to be seen if it's the good of the nation. So what can we do in the opposite end? Can we look item through item? There's a number of items, but I think that's a more general idea.
Dr. Leah or Dr. Aviv,
Thank you.
would you like to make any contribution about what we are talking? You have your time, please.
Aviv, you start and I will continue.
Yeah, sorry, I had to go to my niece. We have the issue with the situation. Everyone is spreading their kids to other people so they can deal with the situation. So getting back to the discussion about data, my comment about that is that when we think about the consideration, and I totally agree with the statement about consent. And I think that's what you added to this discussion is very important notions, and I totally agree with the issue of bias. I think that what we are trying to do, and this is part of the discussion. I started, and then the other presentation also addressed this, is that we have to deal with the concept of bias, and the way that we can do that is that we can. What we can do is to make sure that the data that we're using is actually high quality data. And the problem with high quality data is that we don't always have access to what we consider to be high quality data. And that's a big issue. And when I stated earlier about the regulation and the issue that we have with regulation, so I agree. It's not only about consent. It's also about access. And some of this access is also something that is considered to be relevant for the government. So one of the issues that we're always talking about data that is an individual data, while the best and high quality data is actually data that owned by the government, which is another issue that we have to address if we want to allow high access to high quality data.
Thank you. I would like to point something out and maybe ask the other speakers something if they can address. Tatiana, I think, was making the point that people are giving out their medical records, medical information, I would say medical information, very easily, we could say social media, but of course we can see it today with the new generative AIs. Obviously they are not doing it because they want to give out this information, but because they are looking for some answers or something on the web. They think it's going to help them, and they don't really consider or understand that by doing that their information is out there. And my question to you is, do you think that we, as part of the declaration, need to address this, maybe to caution or to explain patients something about it? I've heard the opening keynote speaker, then the patient the group was expecting us to I would say maybe educate or explain a little bit to the patients. And my question to you is, how do you see this? And obviously it's very different when the person, when you're asking for the data or the provider, or in a clinical setting, then it's a different situation, and they might feel a little bit more pressured than actually giving it voluntarily. So if you can a little bit address the way you see this, and maybe I'll only jump in and ask my question to Miguel. Great to see you, by the way. Just that later on you can both answer. Miguel, you made a very, very important comment about withdrawing consent, and about the basic principle that any patient can always withdraw his consent from participation in a research. But in a big data setting, or aggregated data, how do you think this can be done practically?
Okay, this is a really hard question, right? I don't think we can be able to identify all the problems ahead and then explain to the individual that this problem is going to happen or not. But most of it, people give away or share their data thinking that it's going to benefit them or benefit others. That's the main goal. And then you say, okay, this can happen, this can happen. Oh, this happened, but I didn't told you so because I didn't saw it could happen. We don't want to be in that position of trying to guess what's going to happen. What's happening in social media, and we can see if we can do something like that. And I understand that it's health data, so health data is always more complicated, and genetic data even more. But it's to react rapidly. When something happens, the community will share, the community will say something, and then we have to act rapidly. So, okay, I'm sharing my data here, I'm sensing this is not going to a good place. Where can I press a button and say, I want to tell you this is not a good place? I can see the button for consent. I can see the button for withdrawing consent, but I'm not seeing the button to express my feeling about what's happening. And I think that those type of actions we should make, and should made it like an obligation for especially the health tech they're using, because we can link our health data to Apple, to Microsoft, to everything, and they don't have to obey all the rules that a biobank has to obey and a hospital has to obey. So it's easier for them to treat the data, but without any of the responsibilities that all these other health institutions have. So people should be aware and should have a place to say, I'm not liking this, I'm seeing something wrong. And this is happening with social media. Even though we see that bad things happen, but also the good things to correct it are happening in a rapidly way. That's the point. I'm not sure if I got your question right. Thank you.
Yeah, very good.
Thank you for your question, Leah. I believe that on regards of the right to withdraw, we have a practical difficulty to do that in some cases. So what I think is that we need to improve the way we can give to the individual participant, or the individual participant of a health database or a biobank, to withdraw if he or she wishes. But sometimes this will not be possible, no? Because this depends on how this health database was created. If it was created, for instance, in my iPhone, I have a little hurt there that gives me, in the end of the day, how many steps, without I asking to. This can be collected. I'm sure that this can be collected from iPhones of everybody. So sometimes there is no practicality to guarantee that not participating in a research which is, or withdrawing if you are involved with the research, it will be not possible. But we have to improve the way that this can be offered to the people that can do that. So that's my answer to your question.
Okay.
Thank you.
Yes. Okay.
Good afternoon, everyone. My name is Mantombi Maseme from South Africa. I have two questions, one in relation to misuse of samples and data. Perhaps just to provide some context, I think maybe some views on how we can more proactively safeguard against misuse. There was a case where samples and associated data were exported from South Africa to the US. And then when they got to the US, they were then transferred to the UK, which was not part of the MTA. And also the participants had not agreed to such a transfer. And obviously another ethical issue is that they obviously did not benefit. So as part of the regulatory framework in South Africa, when data and samples, so these samples ended up being commercialized in the UK to produce gene chips, hence the issue of benefit sharing. So as part of the framework, one of the things is that if data is to be transferred, particularly cross-border transfers, there has to be the same level of protection for this data. And also for the MTA, it has to be signed or reviewed by an ethics committee. However, this data ended up, being misused. How can we more proactively, perhaps also from a legal perspective, because there's also a provision in the data protection law that should data be misused, then the institution that misused the data can be sued. But I'm just wondering what more can we do to proactively safeguard this data? And then the second question is relating to incidental findings. So there was a case in South Africa where incidental findings revealed, genetic testing incidentally revealed paternity, but it was in routine diagnostic setting. But let's say paternity was to be revealed as part of genomic research. Would this also count as results that would benefit the participants should they be returned to the participant? Thank you.
Who would you like to answer the question?
Can I?
It's a kind of comment, more a comment than a question, but I believe this, what you refer to, the transfer of data from one country to another country, and how we can regulate this. Maybe Leah or Aviv, who are lawyers, maybe can answer your comment, your question better than all.
I would like also
Okay.
to comment. Okay. Let me just ask you how this happened, because it's not supposed to, right? They're doing wrong thing. This is not supposed to. So how this happened? Which people were involved? Someone pressed a button. Someone put the samples in a box. Someone sent the samples. So look at what happened. So this eventually came to be, and then we can maybe put some responsibilities. I'd like very much on the Declaration of Taipei, they say the responsibility of everyone that sees something. If you see something, you say something, right? And I don't know if we could like put a magic button that says, okay, this is not going to happen anymore, like some laser ray that's going to implode everyone. I would love to do something like that, but it's not possible. And see what happened, because it's not supposed to. We are not saying something that it's okay and then something bad happened out of something that was okay. I think the first thing is it. And I'm not sure if I got your comment right, but this is what I would like to say. Just see the path, what's happening, what can you do to change everyone that tries to do that again, like sue them or something.
Thank you.
I think if I can react, and Miguel and Aviv, I think that we have to think really, there are many ways that gathered information can be misused. Some of it is definitely would be illegal, some of them would be cybersecurity, and we also know that when we are talking about data and data banks and so on, we have also issues about cyber. So I think that we have to be aware of it. I also, and I don't think there's any way that we can 100% protect against it. But we can try to do is to put in some type of mechanisms that would make it unbeneficial for some places and liability. So for instance, you can say that the biobanks themselves or those who are handling the data information, they need to put in defense mechanism to protect the data and protection for the data, and if not, then they would be held liable. And then again, I do agree with Tatiana's idea that we have to look at the chain of where that data was transferred and then used, and we really have to target every single organization or individual along that chain and put in some safeguards over there and making it very unbeneficial for them. So for me, it's a little bit like when you have a liability lawsuit, so it's not only the one who said something, which is defamation of character, but it would be also the one who would publish it, and then the one who would republish it, and so on and so forth. So I think that when we are looking into it, it is important to put regulations and some type of mechanisms and make everyone in the chain responsible, and then in the end result also realize that there is no way we can totally stop this from happening.
Yeah, just to jump in, I totally agree with the comments here. I'll just say that in many cases there are international treaties that are supposed to have this type of mechanism. Instead, I mean, when we deal with data, there are many IP treaties that supposed to deal with those issues. But again, I think this is partially, the resolution is probably going to be the mechanism, and it's not supposed to be as complex as it seems.
Nós temos mais uma pergunta.
We have one more question, and please be short because our time is up. I'd like to ask if this declaration will mention something about those global scientific asymmetries. I've been involved in lots of research networks, among others, and we see that data are collected overseas and here, data that come from our hospitals. The analyses are done in the north of our country, and the publications, the patents are concentrated abroad. And then it reinforces this inequality. So I wonder if there is any point of the declaration that mentions the distribution of it. So then it can be equal. I think that it's something that we discuss a lot, but I don't acknowledge that it somehow is comprised in the Declaration of Taipei or even in the Helsinki Declaration. So it's a point that we've been discussing a lot. It's something that researchers discuss that, but I don't remember having seen that in guidelines or in statements regarding this. I'd like to thank you everyone for being here. Our time is up. Thank you all the speakers for the amazing presentations, and now let's go to the next table. We have the coffee break now. We have 15 minutes of break. Okay, so just grab some coffee.